Hi to Samohan. I hope you have a good day. My name is Nuruliana binti Ibrahim, matric number D01910874448. Now, I will present about my individual assignment for practical test that you are already given. Let's go. For the speed test, the patient is asked to extend his elbow fully supinate, his forearm, and brings the shoulder into 90 degrees of flexion. In this position, the patient is asked to resist downward pressure. To conduct a new test, your patient have to be in a sitting position. With one hand, they press the scapula, and the other hand is internally rotate the patient's arm. And then perform maximally forced forward flexion in the glenohumeral joint. A positive test is pain reproduction on the injured side. To perform this test, your patient have to flex their forearm to 90 degrees in full pronation and stabilize against the body. And ask the patient to perform supination and resist the movement at the same time. Make sure that you palpate the bicep tendon in the bicipital groove. To perform the Hawkins Candidate test, your patient have to be on the sitting position. Elevate the arm to 90 degrees of forward flexion and have it rest on one of your arms. Then perform passive internal rotation. A positive test is the provocation of pain. To conduct the empty can test, your patient have to standing. Elevate both arms to 90 degrees of forward flexion. Then fully rotate internal the arm. And make sure the thumbs point toward the floor. And then I will going to apply downward pressure to prevent further elevation. To perform this test, I have to ask my patient to bring his arms to 90 degrees of forward flexion in the scapular plane, which is also referred to as caption, and then apply downward pressure and ask your patient to hold against it if. Okay, that's all for me for the individual assignment for the practical test. I hope the test that I do is follow the criteria that you want. Thank you, sir.